What is THCV? Was a cure found for obesity and other diseases? What is THCV? The compound known by its long name, tetrahydrocannabivarin, or THCV for short, is a homologue, a molecule similar in structure to THC found naturally in cannabis plant and specially in strains rich in propylic compounds, molecules with propyl group, 3 carbons surrounded by hydrogens. These strains are classified as indica and are common mainly in Nepal, India, China, Afghanistan and South and West Africa. In a distinctive way from CBD, THC and CBC, the THCV molecule is not derived from cannabigerolic acid, CBGA. In order to create it, the plant uses divarenolic acid, an intermediate compound in the cannabinoid synthesis process in the cannabis plant. In the end of the process, an acidic form of THCV is formed called THCV, and it goes through a stage of carboxylation, removal of carboxyl group, oxygen coupled with hydrogen, by heating or UV light in order to form THCV. This substance has unique qualities that are being studied in the past few years, though it was discovered and its structure decoded already at the 60s by Raphael Mechoulam at the Hebrew University in Jerusalem. THCV against obesity. While some CB1 receptor activators were studied and found to improve the state of patients who suffer from diabetes type 2 and cholesterol excess, trial were not taken due to their malicious psychiatric effects. THCV is a neutral antagonist, in pharmacology, a substance that binds to the receptor, block or disrupt its activity, that causes decrease in food intake and behavior and loss of weight in lean mice. In an experiment conducted on 2 mice populations, one that suffers from diet-induced obesity, IDO, and the second suffers from genetic obesity, OBOB, the effect of THCV was examined for all the criteria mentioned above. The groups received measured doses of THCV orally for a period lasting 30 to 45 days. The control group was given AM251, substance similar in structure to a cannabinoid. During trials, lot of parameters were gathered such as weight, water intake, energy expenditure, cholesterol level and more. The results revealed that, though the changes in the water and food intake in the DO group were minor, THCV tended to increase energy expenditure by 7.5 to 17.1%, while the OBOB group showed an energy expenditure of up to 30%. In liver fat test, both groups showed that THCV is much more effective than AM251 at fat decreasing. The researchers agreed and concluded that THCV creates therapeutic metabolic effects in the different groups in addition to improve the health of their glucose and insulin in the blood. THCV to prevent necrosis. Reperfusion wound is a damage done to the tissue when blood flow is restored after a period of an absence of oxygen. This nutrients and oxygen absence creates a state in which, after the supply restoration, causes inflammation and oxidative damage by creating oxygen pressure. This event can occur in cases of stroke and cardiac arrests and can cause other illnesses such as failure to heal chronic wound, acute and chronic inflammation and cell death. The experiment's results showed that THCV activated CB2 receptors, that play a major role in inflammatory diseases. In addition, THCV did not affect the activity of the enzymes involved in the endocannabinoid system. Likewise, the results showed that THCV improved damage that was done to the tissues and decreased oxygen pressure. By looking at this data, the researchers concluded that THCV provides positive effects in the case of reperfusion wound damage by decreasing tissue damage, oxygen pressure and immune response. While discussing what is THCV, this molecule present over and over in many researches that it contains a major therapeutic potential. Already in 2010 a paper was published about a synthesized version of THCV in which it was presented that synthesized THCV is effective for treating seizures. THCV is in a phase 1 of development of a potential treatment for obesity, diabetes and other gastric disturbances. This in addition to its qualities as a treatment for reperfusion wound.